13 Bizarre symptoms of vitamin D deficiency you need to know. 1. Frequent infections. Vitamin D has a powerful effect on the immune system. Low levels of this nutrient can impair your body's ability to fend off infections. Research suggests that people with low vitamin D levels are more likely to suffer from respiratory infections like colds, bronchitis, or pneumonia. A study published in the British Medical Journal showed that vitamin D supplementation could reduce the risk of acute respiratory infections by 12%. This highlights the importance of maintaining adequate vitamin D levels, especially during flu season or the winter months when sunlight exposure is reduced. 2. Chronic fatigue. One of the more surprising symptoms of vitamin D deficiency is persistent fatigue. Many people overlook this, attributing tiredness to a busy lifestyle or lack of sleep. However, insufficient vitamin D can sap your energy. A 2014 study in the North American Journal of Medical Sciences found that individuals with low levels of vitamin D experienced significant improvements in their energy levels after taking vitamin D supplements. 3. Bone pain and muscle weakness. While vitamin D is well known for its role in calcium absorption and bone health, many are unaware that its deficiency can lead to generalized bone pain and muscle weakness. These symptoms are often subtle but can lead to significant discomfort over time. According to the National Institutes of Health (NIH), vitamin D deficiency can lead to osteomalacia, a condition in adults characterized by soft bones, which causes bone pain and muscle weakness. 4. Hair loss. Hair loss can be a distressing symptom, and while it's commonly associated with stress or hormonal imbalances, vitamin D deficiency can also be a factor. Vitamin D is essential for the growth of hair follicles, and its deficiency has been linked to hair loss conditions such as alopecia. A study published in the Journal of Cosmetic Dermatology found that women experiencing hair loss had significantly lower levels of vitamin D compared to those without hair loss. 5. Slow wound healing. If you've noticed that cuts or scrapes take a long time to heal, it could be a sign of vitamin D deficiency. Vitamin D plays a role in regulating the growth of new skin cells, which is crucial for wound healing. A 2011 study, published in the American Journal of Clinical Nutrition, showed that vitamin D is involved in the process of wound healing by modulating inflammation and producing antimicrobial peptides. 6. Depression and mood swings. One of the more bizarre symptoms of vitamin D deficiency is its effect on mental health. Low levels of vitamin D have been linked to depression and mood disorders, possibly because the vitamin affects serotonin production, a key neurotransmitter responsible for mood regulation. A 2013 meta-analysis of observational studies found that individuals with low levels of vitamin D were at a significantly higher risk of depression. Moreover, several randomized controlled trials have shown that vitamin D supplementation can improve symptoms of depression, particularly in individuals who are deficient. 7. Sweaty head. A very specific and often bizarre symptom of vitamin D deficiency is excessive sweating, particularly on the head. In fact, unexplained head sweating is one of the early signs of a vitamin D deficiency and was historically used as a clinical marker to diagnose this condition in infants. While there isn't much clinical data available to explain this phenomenon, medical professionals have noted that head sweating can sometimes be an indication of a vitamin D deficiency. 8. Frequent falls. Frequent falls, especially in older adults, could be linked to low vitamin D levels. Vitamin D plays a crucial role in maintaining muscle function, and a deficiency can impair balance and coordination, leading to falls and fractures. A study conducted on older women found that vitamin D supplementation reduced the risk of falls by 20%, likely due to improved muscle strength. 9. Insomnia and sleep disturbances. Vitamin D influences the production of melatonin, the hormone responsible for regulating sleep. A deficiency can disrupt your circadian rhythms, leading to insomnia or poor sleep quality. This symptom is often overlooked, but it can severely impact your overall well-being. Research from a 2018 study published in the Journal of Sleep Research found that individuals with lower vitamin D levels had shorter sleep durations and poorer sleep quality compared to those with sufficient vitamin D levels. 10. Dizziness. Frequent dizziness, or a sensation of feeling off balance, can also be linked to vitamin D deficiency. This is related to the vitamin's role in maintaining muscle function and the vestibular system, the sensory system responsible for balance. A 2020 study in the European Archives of Otorhinolaryngology suggested a correlation between vitamin D deficiency and vestibular neuritis, a condition affecting the inner ear that can cause dizziness. 11. High blood pressure. While vitamin D is primarily associated with bone health, research has shown that it also plays a role in cardiovascular function. Low levels of vitamin D can contribute to high blood pressure, increasing the risk of heart disease and stroke. A 2013 review of 30 studies involving over 155,000 participants found that individuals with vitamin D deficiency had a significantly higher risk of developing hypertension, high blood pressure. 12. Weight gain. Unexpected weight gain is another symptom that can be associated with a lack of vitamin D. The exact mechanisms are not fully understood, but research suggests that vitamin D deficiency can slow down metabolism and affect the body's ability to break down fat. A 2015 study published in the Journal of Women's Health found that women with higher body fat percentages were more likely to have lower vitamin D levels. 13. Paresthesia, tingling sensation. Paresthesia is the sensation of tingling, prickling, or numbness in the skin. It can occur for several reasons, but a lack of vitamin D can cause this odd symptom, as it plays a role in nerve health. Low vitamin D levels can interfere with calcium balance, which in turn affects nerve function. Research indicates that severe vitamin D deficiency can result in hypocalcemia, low calcium levels, which can cause neurological symptoms such as tingling or numbness in the extremities. Who is at risk? Vitamin D deficiency is surprisingly common. According to the World Health Organization, WHO, about 1 billion people worldwide have low levels of vitamin D, and nearly 50% of the population has insufficient levels. Certain populations are at higher risk, including older adults. Aging reduces the skin's ability to produce vitamin D from sunlight. People with darker skin, higher melanin levels, reduce the skin's ability to synthesize vitamin D. Individuals living in northern latitudes, people in regions with less sunlight, are more prone to deficiency, especially during winter. Obese individuals. Vitamin D is fat-soluble, meaning it can get trapped in fat tissue, reducing its bioavailability. How to maintain adequate vitamin D levels. The best source of vitamin D is sunlight, but it can also be obtained from certain foods and supplements. The recommended daily intake varies by age, but the general guideline is 600 to 800 IU international units per day for most adults. Foods rich in vitamin D include fatty fish like salmon, fortified dairy products, and egg yolks.